Well, good morning, everyone. This is Jason Perry, and I am the National Sales and Marketing Director here at MAS, Medicare Advantage Specialist. And just for a few minutes, I'd like to introduce you to MAS if you're not familiar with us. We are a nationally recognized, award-winning field marketing organization and a leader in the insurance brokerage industry. Our office is located in beautiful Hoover, Alabama, which is just outside of Birmingham. And we are excited to share with you that MAS became a partner of Integrity Marketing Group back in October of 2019. We had a long-standing relationship with Integrity Marketing Group over the years, so it was a natural alignment for us to become a platform partner. And through this, MAS will be able to bring more products, more tools, and more resources to our broker distribution. And we're truly honored to be working alongside other partners in our industry. And Integrity isn't just on the cutting edge of insurance technology, it's leading the way. Developed by world-class experts, our proprietary tools, resources, and exclusive services help customize your insurance experience so consumers can find the right coverage and be prepared for all the good days ahead. Here at MAS, we are proud of the superior support, service, and training we provide to the agents across the country who work with us. We take great pride in our relationships with our agents and our carriers. And our staff provides marketing strategies and assistance, creating numerous opportunities for our agents through our lead programs, our Turning 65 platform, our agency builder program, our Fast Start initiative, and other programs that are also available. MAS marketing managers and directors are eager to work with producers to help you grow your business. And we can provide a market analysis of products available in your area to assist you in developing a strategic marketing plan for your business. And we're always up to date on the latest products, carriers, lead programs, and services as they become available. And of course, we're always available to provide both back office and field support, so making it easier for you to concentrate on sales growth. Our goal at MAS is to help you grow your business. And our specialty is the senior market, and our carrier portfolio is supported by Medicare supplements, prescription drug plans, Medicare Advantage, final expense, whole life, term life, universal life, and annuities, hospital indemnity, critical illness, cancer plans, dental, vision, and hearing, and even some more products. And here's just a snapshot of the portfolio of some of the carriers that we represent, just so you have an idea. And I'm not going to stay on the screen too long. But we do have access to about 80 different carriers. So we do offer lead programs to our agents. I'm not going to read this slide to you, but there are multiple programs that are available to our agents, whether you're in a hierarchy or you're direct to MAS. And even if you're in a hierarchy, there is a lead co-op available to agencies and agents in their downline. So that's great. And so I wanted to show you this. So check out the new Medicare Center. It's really a one-stop shop for everything you need to successfully navigate the sales and enrollment process. You can grow your experience at the Medicare Center with the full power of CSG's resources, like e-apps, data analysis, quoting tools, competitive analysis, heat maps, and an exclusive website plugin to capture MedSup leads. So we could actually put a plugin on your own website where consumers go and run quotes on MedSups, and those actually become leads for you. Some of the carriers inside of CSG Actuarial, inside the Medicare Center, which that plugin will take them to, actually gives them the capability of enrolling in some of those plans. So they could actually technically enroll themselves. So that's a great tool for everybody to have. Here's another one. This is great. This is the T65 app locator. This tool will put you on the cutting edge of technology. It's giving you the availability to run quotes for Medicare supplements, run quotes for Medicare Advantage, compare products side by side, download current applications and outlines of coverage for desired plans. You can even email applications and outlines of coverage directly to your clients. And all agents who wish to use the tool, you basically register and create a username and password on our website. And you must be contracted with MAS, obviously, to have access to all of these products. So the T65 locator makes it really easy to find local Medicare prospects. So it's quick, it's easy to use, and you just pull up your location on the map, and it's super simple. The best part, it's free for agents who do business with Medicare Advantage specialists. So think about being in the field and not having someone to see at that moment. You pull up the T65 locator, it identifies where you are, and then based on the search criteria, it gives you a circle that you've told it to look in, maybe 50 miles or 25 miles, and the little red dots pop up all around you with people turning 65, with their name, with their address, with their birthday, how many days until they turn 65. So now you've got people to talk to immediately. And this can be done anywhere in the country. You can do it in California, and then next week you're in New York, drag it across the country, drop it in New York, and it's going to do the exact same thing everywhere you go. Awesome tool. And we all know that growing your business is only going to happen if you develop a winning strategy. Consistently put the work in and utilize smart tools and platforms that make it easier for you to deliver your expertise to the right clients. And that's why we developed the Turning 65 Workshop platform. We assist our agents in identifying target markets for the Turning 65 population. We created a process that's so simple for agents to follow that now we have so many agents hosting weekly and monthly meetings all over the country, creating a tremendous stream of lead generation. So if you want to know more information, talk with one of our marketing managers or directors today, and I'll give you the phone number here in just a minute if you want to reach out to us. So we have an agency builder program. So if you're interested in building an agency, let us help you do that. You know, we provide recruitment lists, provided alongside of our auto dialer capabilities. We do specialized call campaigns just for you, and we do co-op those programs. So if you're interested, talk to a marketing manager today. New Agent Fast Start Bonus. So for new agents, we have our Fast Start Bonus, a $25 gift card for the first issued app, a $75 gift card for 4 or more apps issued in the same month, and our agent referral bonus is also available to you as well. You get a $50 Visa gift card when a referred agent writes their first app, and that is for direct to MAS agents only. Unfortunately, that does not apply to Medicare Advantage, prescription drug plans, or dental production. So why choose Medicare Advantage specialists? It's because prospecting can be a challenge, but we're here helping you arm in arm with the tools necessary to help you be successful. And we understand that our long-term success will define itself based on your success as an agent or a carrier. Medicare Advantage Specialist is committed to exceeding our clients' expectations in every interaction and helping you achieve that same level of service with your customers. Agent support is our primary goal. We provide every tool we can to identify and assist you in the efforts to identify, inform, close, and follow your sales process. In practical terms, our marketing team works arm in arm with you to deliver print media, internet, direct mail, and other marketing tools to help keep your pipeline moving. And we have one of the most experienced support teams in our industry. So when you work with us, you don't need to buy T65 lists anymore. Plus, you get access to the Medicare Center, free marketing customization, our quoting tools, and really just so much more. So here's how you can contact us today to discuss any of the topics we just went over. It's 800-480-9857, or check out our website, MedicareAdvantageSpecialist.com, and we're really, really excited about working with agents. So you may be asking yourself, what should I be doing right now? Well, we're here busy strategizing during the SEP, planning for SEP sales. And so make sure you reach out to one of our marketing team, as we've got some great data put together on the 2022 landscape, as well as tons of marketing ideas. And so with that being said, let's now get to today's webinar subject. And with us today, we have Brandon Reed, he's the VP of Sales with Heartland National. And we're really so proud to have you here today. I appreciate you being here, Brandon. And I'm going to go ahead and make you the presenter. Let's see if that works.
Wonderful. Thank you, Jason.
And we can see you just fine. Yep, we can see you perfectly.
Excellent. Wonderful. Well, thank you for having me on, Jason, and wonderful introduction. Thank you again, everybody, for your time this morning. My name is Brandon Reed. I am the VP of Sales with Heartland National Life. Excited to have you all on board and interested in writing our products. We do have a great partnership with the Medicare Advantage specialists and have worked with some of the groups under this organization in the past who have really excelled in working with a couple of our products. Today, our focus on the webinar will be hospital indemnity. I know a lot of agents are already out there writing hospital indemnity with some other companies. We'll talk a little bit about how ours stands out in the market and also how to present this product if you're not already working it into your portfolio. So I just took a new position here with the insurance company effective April 1 as VP of Sales. Prior to that, I was field training agents for a field marketing organization on the agency side. So today will be a pretty hands-on practical training. I don't like to get into the weeds too much on the actual carrier and products. I just want to get right into how you sell it and how you work it into your portfolio. So how I do that is I like to make sure clients get all their options, whether they're aging into Medicare, retiring onto Medicare at 68, 70, whatever the case may be. We need to make sure as agents we're presenting all of their options. And if hospital indemnity is not built into that presentation, if you're not giving them an option to fill in those gaps on their $0 premium Medicare Advantage plan, then we're doing our clients a disservice. Okay? So this is why I like to break it down. I like to start with traditional Medicare here on the left-hand side. Honestly, this is a screen that has been used in educational events, whether you're at a Red Lobster or a hotel doing a seminar. If you're doing a one-on-one meeting, I love to print this screen out here and leave this with the client to break it down and keep it simple. As agents and Medicare advisors, we need to make sure the client understands the gaps in traditional Medicare Part A, whether it be the $1,556 deductible, days 1 through 60, the large copays, days 61 through 150 in the hospital, or the Part B exposure, 20% after you meet your Part B deductible. Several exposures we need to make sure that they're aware of so that we as agents can present an opportunity for them to fill in their gaps, whether that be with a Medicare supplement option in the middle and a standalone drug plan, or a $0 premium or low to no plan premium Medicare Advantage policy with a hospital indemnity. Now, the hospital indemnity won't be a fit for everybody. There is underwriting. We'll take a look at it in just a minute. It's up to the agent to do a good job of field underwriting in the home. The Medicare supplement option is simply becoming unaffordable for a lot of people. As we see Medicare Advantage becoming more and more popular, networks getting stronger and stronger, benefits getting richer and richer, Medicare Advantage is becoming a very popular option. Starting to make a push in today's market. We're seeing individuals complaining about the rising cost, the inflation on their Part B premiums, which we just witnessed, the largest increase in history, going from $148.50 to $170.10 this year. On top of that, in this middle option here with the Medicare supplement, paying higher costs for medications on a standalone PDP, which most of the time we have to worry about that $480 deductible on Part D. Okay, this is one way we emphasize the rising cost, the increased deductible amount on Part D, the fact that a lot of these Part D standalone drug plans do not offer $0 copays on Tier 1 and 2 meds in the preferred mail order pharmacy like Part C does. The increasing rate on Medicare supplement policies, right? The fact that Medicare supplement plans do take rate increases and over time your rate will go up. So emphasizing on some of those things presents a wonderful opportunity for us to position Medicare Advantage for a consumer with a hospital indemnity. The reason we need to be offering this hospital indemnity plan, everybody, is to bridge the gap between that $0 premium plan and the Medicare supplement option with almost full coverage in the hospital and on the medical side. So bridging the gap between a $0 plan with a lot of exposure and holes in your coverage to get you as close to those Medicare supplement benefits as possible, but for a fraction of the price. Okay? My job here is to get you as close to those Medicare supplement benefits that you said you couldn't afford, but for a fraction of the price via the hospital indemnity. And oh, by the way, you've got phenomenal prescription drug coverage built into this plan, and you've got extra benefits like dental, vision, hearing, and more. So what I want to do today, as we do have a Medicare supplement in about 10 states, I won't sit too much on this. I know everybody on today's call, or for the most part, should be pretty experienced with Medicare supplements. So I'm not going to get into the weeds on what a Plan G is or what a Plan N is, but I do want everybody to be aware that we do have a Medicare supplement in 10 states, and it is reinsured by Mutual of Omaha. So a reinsurance partner like Mutual of Omaha, giving you the ability to bring that name up in the home. So they might not have ever heard of Heartland National Life based out of Blue Springs, Missouri, but I guarantee they will have heard of Mutual of Omaha. So a 95% reinsurance partner there on the Medicare supplement, and we do have plans N, G, no F currently on the market, but plans N and G in 10 states, with the expectations to expand in another 15 to 20 states throughout the remainder of this year. So Medicare supplements should definitely be a part of your portfolio. As we discussed it, giving people all of their options, that's our job. And what we do on the Medicare supplement side is we pay a pretty kick-ass bonus here, a $300 bonus per underwritten med sup. So this bonus is currently running till the end of June. Those are not effective dates within January and June. Those are submitted apps up until June 30th. So if you're in one of those 10 states that we're about to get into on the MedSup side, you can take advantage of that bonus, $300 per application on the underwritten MedSup. So here are the 10 states in yellow where we do have our Medicare supplement policy. The black states and the yellow are where we have our hospital indemnity. So the hospital indemnity being available in all 36 states with a household discount on both products in every one of those states. The household discount is a real perk. It's a 7% discount, and all you have to do is live with somebody over the age of 18. Doesn't take a heck of a lot to qualify for it. Just live with somebody over 18. There are a few states like Oklahoma, Ohio, and Illinois where you do have to have 2 people apply in order to receive that discount. But in most states, all you have to do, again, is live with somebody over the age of 18. So why sell hospital indemnity? Well, you're going to love this. The hospital indemnity pays on issuance of the policy, so it's a wonderful opportunity for you to generate more income, especially while you're waiting on those Medicare Advantage policies to pay early to mid-January of the following year after a successful AEP. So during AEP, October 15th comes around, you're submitting your first several Medicare Advantage enrollments for the AEP. You're pairing those with hospital indemnity plans. That way they're covered in the event of a hospitalization, a trip to the ER, in an ambulance, maybe even a skilled nursing visit or a cancer diagnosis. We've got the ability to protect your clients from a lot here, and it doesn't cost a whole lot to do it. And while you're doing that, you're getting paid commissions on the issuance of the policy. So the policy doesn't go effect until 1/1. Well, guess what? You wrote the policy October 15th. It's issued on the 16th or 17th. We'll get you paid within a couple days. Very quick turnarounds. So what this does for your client is it protects them, right? It offers coverage to fill in the gaps. That's all this is. Who's your gap plan with? Who's your wraparound plan with? Right? Who's your hospital indemnity plan with? I guarantee you a lot of people haven't even heard of hospital indemnity insurance or don't even know that it's available. So when you tell somebody you can protect them from a hospital copay with a 60-day reoccurrence restoration, that's wonderful. Wonderful news. People love it, and they don't know that it's even an option in most cases. So give them all their options, otherwise you're doing them a disservice. It's a simplified issue policy, meaning yes or no questions on the application. Just do a good job for us, field underwriting. Make sure that they can answer all those questions no. If they have COPD and they're not within our guaranteed issue period, then they should not be issued a policy. You should not be writing the policy. If they've had cancer within the last 2 years, you should not be writing the policy. We do, however, have a guaranteed issue period within ages 64.5 to 65.5. So a 13-month window, 6 months before the month of and 6 months following their birth month. Wonderful opportunity for your people aging in at 65 and taking advantage of Medicare at that time. It increases persistency in the home. So when you leave the home and you write somebody a Medicare Advantage plan, you can feel a lot safer knowing that now they've got two policies with you. And who are they calling when they end up in the hospital or when they get an outpatient surgery? They're calling you to help get them a benefit paid to help them pay their bills. When they get when they get 10 or 15 calls a day during AEP next year, they know that you've customized their insurance to fill in the gaps to where if they do change plans, well, hey, they might be subject to something now in the hospital if their copay is more, right? So they're calling you anytime they have questions about their health insurance. They're not calling into the Joe Namath commercial. They're calling you. With the MAPD market rapidly growing the way it is right now and becoming such a popular option, we need to be taking advantage of a product like this. That way, 5 years, 10 years down the road, these individuals are not coming to us with terrible experiences hitting their maximum out of pockets due to hospitalizations and surgeries. So what I'd like to get into is building one of these hospital indemnity plans. Our e-app makes it very easy to do. We'll demo the e-application in the last 15 minutes of today's call and test out our agent portal to show you how easy it is to work with Heartland National. Building a HIP plan doesn't take a whole lot. All we need to do, whether it's an under 65 health plan or a Medicare Advantage plan, we just need to identify the gaps, fill in the holes. So for Medicare Advantage specifically, we review the summary of benefits. It allows us as agents to do a much better job presenting the MAPD plan, identifying holes in their coverage. I guarantee agents aren't spending a heck of a lot of time talking about that hospital copay that restores every 60 days. Days 1 through 5, days 1 through 6, whatever it may be. Agents typically like to move through some of that and get to the submit button. This product here allows you to really touch on that, hit on that, and give them the opportunity to protect them from that. I guarantee as well, agents are not focusing a whole lot on that 20% coinsurance on chemotherapy and those high costs on radiation, the Part B drugs. I bet agents aren't spending a heck of a lot of time on that, and we should be. We need to make sure that they know that there's a way to protect them from some of those exposures. So we can do that by identifying those copays, explaining to them what is a maximum out-of-pocket, right? Emphasize on why it's so important to have some protection. That way, while you're working your way up to that maximum out-of-pocket, you're not having to pay anything out of your own pocket. So we'll jump into quoting one of these plans. I'll talk to you a little bit about how I've done it in the past. It's a pretty easy sale, takes about 5 minutes. And you can really build it into your Medicare Advantage presentation. So as we said, we'll take a look at a Medicare Advantage summary of benefits. We'll identify what gaps we can fill and what gaps we can't fill. It's important we do that. So I usually like to get a little bit of a nod here, some type of yes, by opening it up with what we can't cover them for. So Mr. or Mrs. Jones, as you know, if you take out this plan today, or based on how your current health plan works, if you need to see your primary care doctor tomorrow, you'll be subject to a $10 copay. Most of the time we'd see a $0 on plans these days. If we need to go see a specialist on this plan, you'll pay a $45 copay. Unfortunately, I don't have the ability to protect you from some of those smaller gaps, but are you able to afford that? And you should get a nod, you should get a yes. Don't know many people who can't afford $10 to see a primary care doctor. If they can't, they don't need one of these plans because they should be getting help with their cost share from the state. Their share of the costs from the state. But what I can do, Mr. or Mrs. Jones, is I can protect you from some of the bigger exposures related to your health plan, such as you can see below, your $340 copay, days 1 through 5 in the hospital. This is something I can protect you from, and it doesn't cost a whole lot to do it. Just remind me, and I'll show you how to do that in just a moment. Okay, is that something you feel you'd like to pay for out of pocket? A $1,500, $1,700 bill for a 5-day hospital stay? Or would you prefer to be covered? Oh, I'd prefer to be covered. I don't want to have to pay that. Is this something you want to pay? No. Right? So get them to make their decision right there, then and there. And I'll tell you right now, it's going to cost for a 65-year-old about $25 to $30 to do that in most states. Moving down, let's identify some of the other exposures that we can cover through one of our 7 riders. Skilled nursing. Yes, Mr. and Mrs. Jones, I have the ability to protect you from that as well. $188 a day, days 21 through 100. Or on this older summary benefits, 160 days 21 through 49. Outpatient surgery. Rather than you paying $340 per surgery, we can protect you at $400. That way you make money for each surgery twice a year. I can't do anything about that $100 diagnostic service copay. It's only $100. Is that something you can afford? Yes, sir. Yes, ma'am. I can afford that. Diagnostic services, I can afford that. How about the ambulance copay? I've got the ability to protect you from that for $2.40, Mr. and Mrs. Jones, and that's a benefit that pays 3 times a year. We'll get into the weeds on some of those details in just a minute. So that's a benefit I can protect them from. I usually build that in to their base quote. I build that in to the hospital indemnity, okay, base plan for an extra $2. That way, on our base plan, we're already covered in the hospital. Our base plan also includes a $150 emergency room benefit that pays 4 times a year. No additional premium for that. And then a $2 ambulance rider versus $8 or $9 with some of our competitors to add the ambulance. The ER is already built in, and the hospital benefit built into the base plan. Rather than you paying $90 to go to the ER, you'll receive a check for $150. That way you actually pocket $60 in that scenario. This is an indemnity plan. We pay you cash. You get a check directly from the insurance company. All the company needs, we don't need some fancy claim form. All we need is a copy of their itemized bill or UB04 in order to get them paid. And that can be emailed, faxed to us at customer service. And guess what? That fax number and email address is on their policy ID card that they take to the hospital with them, with their Medicare Advantage ID card. Okay? We emphasize right here what this maximum out of pocket is. Make sure they understand that this is the most they could spend in a health year in a year on their medical costs. Only about 3% of people in the whole country hit this maximum out of pocket each year. Do you want to know the most common reason for hitting that max out of pocket? Who makes up the majority of that 3% of people? It's those who are being diagnosed with cancer. Do you want to know why? Well, it's because on your plan, again, this is something your agent should have told you about, right? If you're changing their plan next AEP, or if you're just meeting them for the first time and they've already got a plan, this is something they need to be aware of. You have a 20% coinsurance for chemotherapy on your health plan. And that, my friends, is how you now insert the cancer rider and position anywhere from $1,000 to $20,000 in cancer benefit, all in one sale. An affordable rider, I'll show you how I talk about that and how I create value on the cancer benefit. But before we do that, let's look at an example here. An out-of-pocket example where somebody takes a trip in the ambulance to the emergency room and is hospitalized for 5 days on this health plan. In this scenario, they would be left with a $2,015 bill. Some of you may argue most plans waive the ER copay if you're admitted within 24 hours. Okay, still right around $2,000 in out-of-pocket costs. And guess what? Even if that ER copay is waived, you're still getting the $150 emergency room benefit. So you're making money. So Mr. and Mrs. Jones, this is what you would be responsible for if this happened tomorrow. If this happened next month. Okay, it's important they see that. Here's a real life example. And did your agent tell you that hospital copay up top, that restores every 60 days? I get a lot of people, their eyes open up wide there, their ears lift, and they tell you, no, I didn't know that. Nobody ever told me that that's a copay that restores every benefit period, every 60 days. So at that point, you create value in the hospital indemnity plan because that's not just one $1,700 bill. That could be multiple $1,700 bills for several hospital stays that year. So Mr. and Mrs. Jones, rather than you being subject to those costs out of pocket, what we can do today is we can protect you for about $31.53, for exactly $31.53, and leave you with a check to help pay that bill. So you, in this scenario, would be left with an $85 benefit after paying your bills. you would pocket $85 in this scenario. Excuse me, the screen. Here's how our base plan works. Here are some of our plan highlights. Our base plan is pretty flexible. That's why we call it the Secure Advantage Flex, Hospital Indemnity. Our base plan ranges from $100 a day to $600 a day in benefit, covering both accident and illness. Okay, this is a benefit that ranges in $50 increments. So if you have a $295 copay for 6 days, we can cover you at $300, right? Those benefit periods ranging from 3 to 10 days, 15, 20, or 31 days, other than in Utah where they limit you to a 10-day minimum in Utah. But in most states, 3 to 10 days, 15, 20, and 31 days in benefit. So if you have a $7 copay, you can cover them at 7 days. What a lot of agents are doing nowadays is protecting their clients from inflation. On this benefit, you have the ability to protect them from more than what they're subject to. Maybe right now they've got that $295 copay for 6 days. Next year, that could be $350 for 7 days. So a lot of agents like to upsell this benefit period here and maybe add a little extra hospital benefit to that benefit amount up top. That way they're protected, because guess what? Mr. and Mrs. Jones, these plans are not standardized like Medicare supplements are, right? Your Medicare supplement that you mentioned you couldn't afford or you're wanting to move from, it's standardized, meaning the benefits will never change. That Plan G is always going to cover your 20%. You're always going to be subject to that Part B deductible. This year it happens to be $233. Next year it could be $250, right? However, these Medicare Advantage plans, the one you've got or the one we're moving you to, they can change, and that's why it's important to protect you from from inflation. So, just a quick way to work in a little additional benefit there to protect them from rising health costs. Observation is something we do cover. It's built into our base plan. It's a benefit, doesn't cost anything more. That covers you at 100% of your hospital confinement benefit. So if you're put in observation for, let's just say, even 1 hour, we will pay 100% of your hospital benefit for that stay in observation. For our base plan benefit to pay on a hospitalization, you have to be confined for a full 24 hours. For observation to pay, all you need to be in observation for is even 1 hour, we would pay a benefit. So you do not have to be in observation for a full 24 hours to pay. And that pays 3 times a year. We talked about the ER benefit built in, no additional premium. That pays 4 times a year at $150 per visit. And our base plan, our hospital base plan, restores every 60 days. That way, when that copay restores, we've done so as well. We have a guaranteed issue period, ages 64.5 to 65.5, we talked about earlier. No health questions asked. However, those individuals are still subject to the 6-month pre-X. So we do have a 6-month pre-X, meaning if you get on guaranteed issue and you have COPD, you need to wait 6 months in order for a benefit to pay relating to that pre-existing condition, even though you qualified through guaranteed issue. Okay? That 6-month pre-X also applies to non-guaranteed issue as well. We'll take a look at some of those health questions in just a minute to finish up our call. This policy is issue ages 18 to 85, meaning it's not limited to just the Medicare and over 65 market. You can position this product like a lot of agents do right now in the under 65 space. I'll talk to you a little bit briefly, very briefly, on how we do that and what rider agents take advantage of when doing that. We have a household discount available to all ages at 7% as long as you live with somebody over the age of 18, as we discussed earlier, except for in Oklahoma, Ohio, and Illinois, where you have to have 2 people apply based on their state rule. Men and women pay the same rates, and it's issue age rated, meaning our rate locks in. If you buy the policy at 65, 10 years later, you're 75, you're still paying the 65-year-old rate. Big time. It's a simplified issue policy. I emphasized on that earlier. Yes or no questions on the app, making for a speedy application process. As long as they can answer no, go ahead and submit the policy. As long as they can answer no to the 2 cancer questions related to our cancer rider, looking back 5 years, you can be issued a policy. A 6-month pre-X, again, limiting individuals not to be paid a benefit on anything pre-existing for the first 6 months. We have a dual application available on both paper and e-app. There is a $25 policy fee, okay, to be mindful of. It's never been an issue. I've sold a lot of these in the past, and it's not an issue unless you make it one. This is a $25 fee, Mr. and Mrs. Jones, that you'll be charged one time. It's a processing fee, right? People who are processing these applications need to get paid. We use a third-party admin to do that. So a policy fee, and if you're taking advantage of our dual application, that second applicant on the form does not get charged a policy fee. So only one individual will be charged that fee. We have 7 optional riders. We're going to fly through these, and then we're going to walk through them in our e-application, and I can talk to you a little bit about how I position some of these. A lump sum cancer benefit ranging from $1,000 to $2,000 in benefit in $1,000 increments. Okay, pays 100% on internal cancer, 25% on in situ, non-invasive stage 0 cancer, and 5% on skin cancer. A lot of companies don't pay anything like on in situ and skin cancer. We pay 25% again on in situ and 5% on skin cancer. That's out of your lump sum benefit. And in most states other than Georgia, we have a built-in recurrence benefit. So most companies charge you an additional premium to add something like this on as a rider on standalone cancer plans. What we see is it's built into our cancer premium. So if you're paying $15 a month for a $5,000 cancer benefit, you've also got the ability to cash out another benefit on the same rider at 10%, 1 year cancer-free, 25%, 2 years cancer-free, and all the way back up to 100% after 5 years of full remission of cancer. So you're not taking any meds for it, you're not seeing the doctor for your cancer anymore, and you're not being treated for that cancer anymore. And the cancer's gone. That's when these time periods build back up, okay? 5 years cancer-free back up to 100%. There's a lump sum hospital confinement benefit available on this plan, commonly used in the under 65 space. You've got a short-term medical, major medical, ACA plan. You've got a large deductible on your health plan, high deductible plan G maybe. Well, guess what? We can position a lump sum hospital benefit up to $2,500 to pay on 1 day in the hospital. Okay, if you're hospitalized for 1 day, you'll receive your base plan benefit, whether that be $100 to $600 a day, as well as an additional up to $2,500 for that hospital stay. And that benefit can pay twice per year. It's a little costly when used in the over 65 space. We do see a ton of that being sold in the under 65 market. We have a lump sum outpatient surgery benefit available up to $1,000 per surgery. That also pays twice a year. So Mr. and Mrs. Jones, you have a $290 copay for outpatient surgery. Well, we can position this at $300. That way we're getting you as close to those Medicare supplement benefits as possible, but for a fraction of the price. Skilled nursing, guess what? You would have been covered on the Medicare supplement as well for about $13 a month rather than you paying $150 for your supplement. We can protect you in skilled nursing at $150 a day, or for about $16, $17 a month, we can protect you at a full $200 per day in skilled nursing. And there's no rate increases on this benefit, on any of these premiums, like there would have been on the Medicare supplement. A benefit that pays days 21 through 100. Okay, if you've got a $188 copay, days 21 through 49, you'll be covered. If you've got a $188 copay, days 21 through 100, you'll be covered. You'll actually be making about $12 a day at that $200 option, which also protects you from inflation. An ambulance benefit, okay, available at $200 per trip 3 times a year. Not contingent on hospital admission, just like our ER benefit. You do not have to be admitted to the hospital in order for these ambulance and ER benefits to pay. That's a big one. A lot of companies are starting to add that in now that they see us offering that. It includes air and ground ambulance. A wellness benefit also available at $25 per health screening. Okay, this can pay 4 times a year, a total of $100 in benefit. Costs about $2.80 a month. Add a little rider like that. You know, paying for immunizations, vision, hearing exams. You might have a $0 copay for one of these services listed on the right-hand side, And guess what? As long as you let us know, Mr. and Mrs. Jones, you send us the bill, even if it's a $0 exposure, we will pay you $25 just for seeing that you had that blood sugar test done or that immunization. That's all we need. A dental vision hearing rider available at $1,000 and $1,500 in benefit annually. So a benefit with a $100 deductible that is waived for the following services once you've had the policy in force for 3 months. $75 in dental cleanings, $50 in vision and hearing exams. We don't want somebody going in for a dental cleaning 3 months in and not being covered for that service, so we waive the deductible after having the policy for 3 months. There's a 6-month wait on the basic services and a 12-month wait on your major. A $200 prescription eyewear benefit built in to that basic service benefit. So $200 in addition to Mr. and Mrs. Jones, your $100 or your $150 that you're getting from, let's just say, United Healthcare, for example. That's each year. And again, this is an indemnity plan. You can go see any doctor. You can go see any eye doctor, any dentist. There is no network, any hospital. There's no network on any of these benefits, okay? And that's what makes this dental vision hearing rider so great. You can go see any dentist. We pay in addition to whatever your other dental plan and your other Medicare Advantage plan is paying. All we need to see is the bill. Show us proof that you had that filling done 6 months in, and we'll pay 60% of those actual charges for that filling after 6 months. 12 months goes by. Okay, we're in year 2. We pay 70% of those actual charges. You need a crown. You've used up, let's say you're paying 50% on those crowns on your Medicare Advantage plan. You've used up your $1,000 benefit. Well, here's an additional $1,000 or $1,500, and Heartland National will pay 70% of those costs in addition to whatever your other plan has paid. No coordination of benefits. This is separate. All we see is the bill, and we pay 70% of those costs year 2, 80% year 3 and beyond. Great benefit. So I'll open it up for some questions in the chat box, and then what we'll do is we'll jump into our agent portal, and we'll demo the e-application. Hopefully I've covered mostly everything. I'd like to do a pretty thorough job. Shayna or Jason, if you would, just let me know if you see any questions in there in the chat box.
No, I think you've done a really great job explaining everything. We don't have any questions at this point.
Very good. Well, we're making good time. We got about 15 minutes here for us to demo our agent portal. For those of you who don't have a contract with us currently, you'll see our agent website is heartlandagent.com. So www.heartlandagent.com. We like to make it easy. Your writing number is your username, and you will have created a password during the contracting process, which again, the contracting process, for those of you who don't know, takes 24 hours. You finish your contract, we'll probably have it approved that day, as long as you submitted it in the morning. Otherwise, we'll get it approved the next day, and you'll have a writing number and be able to submit business. So log in with your writing number and the password you created during contracting. If you need a contracting link, reach out to the Medicare Advantage specialist or your upline under the Medicare Advantage specialist to get some help. Once you've got an agent or agency contract, you will have the ability to onboard downlines as well using our contracting portal. A very easy tool. Again, you send the link. All you need is their email and name. We can help you with the commission levels that are available under you. So can Jason and the team, and we can get those links sent directly from your portal to your downline. Once your downline is set up, they can do the same thing. We also have a supplies tab. This is a wonderful area for us to use. There's a drop down to where you can select your state. We can download a copy of the paper application. That way, maybe we print off page 2, and we have a list of those health questions in our bag or on our desk. This way we remember, okay, if you're within 6 months prior, the month of, or 6 months after your 65th birthday, these questions don't apply to you, questions 1 through 3. However, what questions do apply to you are questions 4 and 5 if you're applying for the cancer rider. So COPD, AIDS, HIV, stroke, heart attack, kidney disease. We do accept and take up to 50 units of insulin for diabetics, as long as there's no complications like neuropathy or retinopathy. Okay? Looking back 2 years on all this. 2 years if you've seen a physician, been diagnosed, treated, or taken meds for the following. There's a question on here. We're going to get this removed when we refile. If your client uses a CPAP for sleep apnea, you can answer this question no. We do accept CPAPs for sleep apnea. Okay, so you would just answer no and move on with the application. And looking back 5 years for cancer for the rider. Pretty easy paper app. However, let's get into the e-app. We'll show you what it looks like. It's an easy process. That's the whole app right there. Okay, personal info on page 1. Again, a dual app available on both paper and e-app. A contact us tab for you to get any questions you have answered. And an easy to use e-application. So what we'll see here is you do have, again, the ability to write 2 people at the same time. What that allows for is in every state you'd be able to apply for that discount. If we were only doing it in one state, you would not qualify for this discount. In a state like Illinois, you would have to have 2 people apply in order to qualify for the household discount in Illinois, Oklahoma, and Ohio. So we'll use Alabama for the demonstration. We'll go ahead and fill in the gaps. Let's say we have a $295 copay for 5 days. Watch how affordable this is. $295 for 5 days. Let's cover them at $300 for 5. Unless you want to protect them from inflation, you can do that. We'll run the quote. We'll get up here. We can review that base benefit. Only costs $27 a month. Not to mention you get about a $2 discount since you live with somebody over 18, Mr. and Mrs. Jones. So $25.11. And guess what? That includes $150 in the ER 4 times a year. So if you need to, let's do this. I always add this on right out the gate. Now we're up to $27.34. Mr. and Mrs. Jones, in that previous scenario, you were subject to $2,015, right, for that 5-day hospital stay. Rather than you being subject to that $2,015, you would receive a check for $2,100. And that's what we're doing here. We're covering you for a similar scenario at $300 for 5 days. And again, you will be paid $150 instead of being subject to $90 or $120 for that ER visit. We've got the ambulance benefit built in because it doesn't cost much to do that. Pays 3 times a year, so $600 in benefit down here on the ambulance. Mr. and Mrs. Jones, we discussed the importance of a cancer benefit on when customizing your insurance. The reason for that is, right, you go over the odds for cancer. You ask them if they know anybody who has experienced chemo or gone through being treated for cancer. How long did that last? Was it just 1 year and done? Or did that go on for multiple years? Usually people are being treated for cancer for more than 1 year. So that results in people, having higher odds of hitting their maximum out-of-pockets. So what I'd like to do is at least protect you from 1 year of hitting your max out-of-pocket, maybe 2. So we can do that. We can protect them from 2 years of their max out-of-pocket. Let's say they've got a $4,900 MOOP. Here's a $10,000 cancer benefit. Doesn't matter if it's 10 or 5. Watch this, 10 or 5. It's in increments of $16. Now with the discount, it's even cheaper. So what I like to do here, if it's a phone sale, I like to have Mr. or Mrs. Jones take out a piece of paper and a pen. Mr. or Mrs. Jones, this is a $5,000 cancer benefit. What did you say you were paying for it? Well, you were paying $16 minus 7%. Okay? $14.88 a month. So what is that times 12? That is your annual premium, Mr. and Mrs. Jones, $180 a year in premium. What I like to do at this point is I like to have Mr. and Mrs. Jones take out a piece of paper and a pen. Write this down for me. Your annual premium is $178 for this benefit. You're receiving a $5,000 benefit on the diagnosis of cancer. What is $5,000, your benefit amount, divided by your annual premium? This number shows me, what this number does is it shows me 5,000 divided by 180, shows me that it will take you more than 28 years to pay more into that benefit than you would receive from a one-time diagnosis of cancer. Not to mention, 5 years later, you've been in full remission of cancer and you're paid another benefit. That would take you over 56 years to pay more into this plan and premium than you'd receive from a two-time payment. So I like to create some value there. That's why this is so important. Rather than you paying for all those costs as you reach the max out of pocket, like those 3% of people do, you're protected. I like to position some outpatient surgery here to protect you from that $290 copay per surgery that pays twice a year. A benefit here, we can protect you from, Mr. and Mrs. Jones, would you like to protect yourself from most of that $188 copay? And excuse me while I move my GoToMeeting cog here. For $13.80 or all of it for $18 a month minus the discount. You know what? I'm okay to protect. I would like to protect myself from all of it. My wife, before she passed away, was actually kicked out of the skilled nursing facility because she couldn't afford her $188 a day in skilled nursing. Right? And that's a scenario I've run into. And you can go over that and use it as your own. But I know somebody who's been kicked out of skilled nursing because they couldn't afford their copay days 21 through 100. And if it's traditional Medicare, $194.50. A wellness benefit that pays 4 times a year, and a dental vision hearing benefit available. So again, this is at least half of what you'd be paying for a med sup, right? In most markets, especially for men. We can now, for quite a bit less or less than what you'd be paying for a Medicare supplement, unless you're in North Carolina or somewhere Texas where everything's cheaper in Texas, you'd be paying more than this for a Medicare supplement. Now you've got some great benefits getting you closer to a med sup with no network on these, and extra dental vision hearing coverage up to $1,000 to help you pay for those fillings you said you needed, or those crowns that you were talking about. You said dental's been a big deal for you in the past. You've always had to pay a lot out of pocket for dental. Well, we can protect you from that. But for the sake of today's demonstration, we're going to move forward without the DVH rider. We're going to look at our health questions that are automatically answered no because we're within our guaranteed issue period. Okay, again, if they use a CPAP for sleep apnea, go ahead and answer that question no. We'll answer the 2 questions related to cancer because even if you're guaranteed issue, you can't get a cancer benefit guaranteed issue. Otherwise, we're shooting ourselves in the foot here as an insurance company. Okay, fill in the last name, man or woman, male or female. And if you've got any questions, we're almost done here, so go ahead and throw them in the chat. We'll get them answered after we get this puppy signed. Throw in their address. So we have paid for a text message signature option from DocuSign. We're currently working on getting that plugged into our e-application and available to you all. Right now, we're limited to the DocuSign via email or in-person signature options. If you don't have an email, you click Not Applicable. It'll let you know you have to get the app signed in person. So save and continue. We'll test out the email signature process. I'll show you how easy it is. Here's your household discount question asking about your household resident who lives with you. If they don't live with somebody, I usually joke around here, how about a dog? How about a cat? And do you have a dog that's over 18 years old? No, nobody has a dog that's over 18 years old. Not many people. So we kind of just laugh there. That way, when you get to the bank info and the Social Security, you're actually the bank info here on the next page, you're kind of in a good mood. You've joked around a little bit. Oh, you don't have a cat or a dog that's over 18? That's too bad. But that won't qualify you anyways, so not to worry. Okay, so here's our effective date. Important you fill that out. We can go up to 90 days out. That way, if you're writing during AEP, you can start putting these in for 0101. You can use our calendar or just come in here and write it. Select your premium mode. On eApp, we don't offer a direct bill. You have to use our paper application if you want to do a quarterly, semi-annual, or annual direct bill. Okay, you'll see here, this initial premium includes a $25 policy fee. Mr. and Mrs. Jones, that's just a one-time fee. Then you'll see your premium drop back down to $70 and change. $77.47. Down here, we'll have to select our draft type. Do you want that initial premium to come out now, or do you want it to come out closer to your effective date? Let's just say they want it to come out on June 1st. Okay, the policy is going to start June 1st. I'd like my premium to come out June 1st. Well, not a problem, Mr. and Mrs. Jones. I'll set it up that way. I'll also set your recurring draft to come out on the 1st of each month. This right here, bank draft day, is your recurring draft. Don't go outside of 10 days here. We do need our premiums collected within 10 days of the benefits being administered. So if you select the 11th or if you select the 15th, you're now outside of 10 days from your effective date. We are going to draft your July premium on the 15th of June. We're going to draft in the rears if you do that. So rather, go ahead, if they need it after the 3rd of the month, just go ahead and do the 3rd or do the 10th. You can go all the way out 10 days from the effective date. And in this case, Mr. and Mrs. Jones, your July premium will draft on July 10th. Your June premium will draft on the 1st of June. Nice and easy, okay? And this is it. Oh, excuse me. And I'll pause my screen share for just a minute to put in my account number here. Nobody saw that, did they? Okay. Outline of coverage, quick click. Guide to people with Medicare, quick click. Click and open. That's it. Now, who do you want the policy being sent to? I want it going to the applicant. I accept. Just a quick acknowledgement. We're signing it in Chesterville, Alabama. Put in the producer's phone number here. And save and continue. About 2 minutes left. I promise I'll get this done before the hour. Did you complete the application in person? No. I'm doing it over the phone. Did you and the applicant review for correctness and omissions? Yes. Are you related? No. And no, and no. Go ahead and write the policy here. HIPAA form, health authorization? Yes. We certify? Okay. DocuSign via email or in person. The in-person signature process is the exact same as email. So it's a good idea to, pay attention to that signature process. That way you can walk them through it when they get an email. So here we will put the agent's email address in. It's asking for the agent's email. That way you get a signed copy of the app once it's been signed. So you can download an unsigned copy of the application here, or once it's been signed, just save that one for your records. Not sure why we're getting emails from these guys here. All right. View document. In your case, you will see a white checkbox here, Mr. and Mrs. Jones, in the bottom left or the top left of your phone or your computer. check the white box that says I agree to signatures, click continue, click start, click sign. When they click sign, they'll be given the option to draw or adopt their signature, okay? And then all they have to do again is hit sign and finish, okay? Sign on the HIPAA form and finish, okay? Once they click finish, they'll open up their email. They'll get another email from H&L administrator letting them know they've signed the application and everything's done that's needed at this point. After a couple days, about 24 to 48 hours, you will see the policy submitted in your portal under your recent business tab. And you can track commissions, which are very easy to do. You can download spreadsheets or PDFs and track those commissions in your portal. You pay a 9-month advance on the issuance of the policy. If you don't want advancing, we can do as earned. You just let us know. So that's all I have, Jason and team. Thank you for your time today.
All right, Brandon, we thank you very much. And there are no questions in chat. You did a very thorough job.
Okay, wonderful.
Thank you, everyone.
Thanks, guys.
All right.
Thanks, Cal.
Take care. Bye-bye.
Bye-bye.